here I am showing how to do a toxin injection. This is really a very busy part of my practice. I spend most of my days just doing injectables. And the reason that we use toxin for people is because it essentially stops the brain communicating with the muscle. So for the 2, 3, 4, 5 months that toxin's working in your body, you cannot get the muscle to work fully. So if you can't get the muscle to work fully, you can't crinkle the skin above it, and then those lines and wrinkles will start to fade away. As you can see, it's a teeny weeny tiny needle. It's nothing to be scared of. It's really pretty pain-free. Generally speaking, the toxin will take 2 to 4 days to have any effect at all, and the full effect is always around 2 weeks' time. Now, the thing to bear in mind about toxin is that you can't take it out again. It will wear off over time, but the best thing to do if you're having a brand new, if you're having toxin for the first time is don't go in and have loads and loads at the beginning, because you might get a result you don't like. It could look too frozen, too stiff, and you'll just have to wait for that to wear off. The best thing to do with toxin is actually to have a small amount to start with, and then you can always go and see your practitioner 2 weeks later and have a little more if that's required. This is a really fantastic little device. It's actually a pain laser, but what it's doing is it's promoting energy into the cells. So it's not unusual that you might get a bruise, because it is quite a lot of injections. And I do know that Debbie does, we can get some bruising with Debbie. So what we're doing is post-injection, just using this to promote a bit of healing, especially here because we were worried about getting a bruise here. So other things that can help with bruising are arnica. I'm quite a fan of arnica. And I'm just going to do, because we did a little bit of Botox here as well. So, can you feel anything at all with this laser?
Just a slight sort of pleasant little, but that might be psychological, that I know you're waving something nice around me and the injections are over. No, it's not like you can feel heat or anything.
No, it's not painful at all.
No, not at all.
Some people don't feel anything, and then some people feel it's like a whisper.
Yeah, it's almost like just a...
It's almost like a tiny breeze going.
Yes, exactly. That's the sensation. But then you think, am I thinking I'm feeling that because I know it's there?
My least bruisey patient. My most bruisey patient.